Hi, thank you so much for tuning in. My name is Kathleen Guan, and this is a pre-recorded presentation for the Digital Innovation in Mental Health Conference 2024 around the theme of creative co-production in mental health. I am a PhD candidate in digital health at the Technical University Delft in the Netherlands, and in this presentation I will be sharing some insights from how my colleagues and I are currently co-designing personalized mental health tech with youth. So why youth mental health and personalization? Youth, particularly adolescence and young adulthood, constitutes a formative developmental stage. Events, habits, and behaviors that are set during this time really create the foundation for lifelong well-being. Youth also make up 25% of the global population, so they are a significant population to engage in mental health programming. It's also key to think about mental health as intersectional, where each individual's mental health risks are uniquely shaped by their particular biopsychosocial factors. So this may include their own family history of mental health, but also the support network that they have around them, the health policies that affect mental health access in their particular geographical region, and many other diverse determinants. This is also why it's particularly important to pay attention to particular risks that can lead to health inequities in terms of mental health outcomes, particularly around marginalized populations such as those with a migratory background or currently experiencing low income, among others. Finally, youth are digital natives who are very comfortable with tech, so this also makes it very ideal to engage them directly with mental health support through tech. In terms of the actual personalization of mental health tech, with advancing technology such as artificial intelligence and large language models, it's increasingly becoming possible to move away from mental health tech that is not very relevant, that is standardized and one size fits all, to interventions that are much more personalized to each individual. And what this requires is leveraging technology to ensure that interventions are context aware, taking into account multiple determinants of an individual's unique intersectional risk factors for mental health, and also ensuring then that the personalization of support over time is ongoing and dynamic. So this ensures that the relevance of health support is very precise from moment to moment and changes over time. To give an example, this study conducted by O'Donnell and colleagues successfully showed how text messages can be dynamically tailored and personalized over time through personalized monitoring to support health behaviors, in this case, drinking alcohol consumption. And so we see this as a successful example of personalization to ensure the relevance and engagement of health support from moment to moment, creating more engaging health support for the individual, leading to better mental health outcomes. However, with all these opportunities and potential, of course, there's also many challenges and concerns when it comes to personalizing mental health tech. And first and foremost is personalization requires actually having a deep and valid and realistic understanding of how users actually want tech to be personalized for them. So this requires participatory engagement with the communities that will be using this tech, co-designing personalization strategies to ensure that the health support is relevant, engaging, and effective. With artificial intelligence, there also are many ethical risks that the community is still trying to figure out. So this includes safeguarding user privacy, mitigating algorithmic bias, and finally ensuring the equity of interventions being able to reach everyone. With the fast rise of large language models being able to process large amounts of data and support text-based interventions like chatbots, there's a lot of potential. But this personalization requires the large language models to be trained on quality data. And this brings us back to this need for participatory engagement, because for data to be high quality, it should be validated directly with the communities that will be using the tech in the ultimate scenario. So in this particular case with youth. So in our current research group, we are using a number of techniques to engage youth in participating in mental health tech design, particularly by co-designing together scenarios for personalization of large language model content. We first start with developing collaborations with community health organizations and schools. Building trust with the communities that we want to collaborate with is essential, because ultimately these interventions in tech should be prioritized in terms of helping the ones who really want to be using them and being led by them to ensure that this tech resonates with them and also matches with their values. Once we've built this trust and developed these collaborations, we then hold a series of fun interactive workshops where we ask youth to consult us on what well-being personally means to them, and how they define well-being and how mental health tech can perhaps support that. We also then have interactive activities to teach the youth about artificial intelligence and large language models. After this, we have youth help us brainstorm scenarios for the large language model to personalize health support. So this includes fun activities like role playing, but also physical drawings. We provide them with prompts based on insights from our own research team's ongoing research. So these are sketches that we ask the youth to review, evaluate, comment on, and also elaborate on to help us co-design scenarios for the large language model training. So in this case, you see a case study of an adolescent who is having a difficult time at home due to family conflict and could really use some mental health support. And this scenario was initially constructed through machine learning of over 40,000 anonymous youth forum posts. So we show these to the adolescents and have them validate the patterns that we observe from our data-driven analyses, but then have them improve upon it. Other data-driven techniques we use is also to create personas. So this is an example of persona that was developed with the Survey to Persona platform, which uses machine learning to identify patterns in survey data to be able to show characterizations of various phenomena. So in this case, we use the data set of the Wellcome Global Monitor, which is the largest or one of the largest mental health data sets in the world, assessing responses from over 100,000 individuals in 113 countries. Here we see an example of an adolescent named Theodora living in Cyprus and the specific ways that Theodora currently manages her mental health, for example, by spending time in nature. With Survey to Persona, there is a very nice interactive feature that the youth in our workshops can engage in, which is being able to actually chat with the persona. So here you see the example where the youth can ask Theodora, what do they do for fun? And Theodora then responds with some insights that are directly derived from the responses to the actual survey. Here we see further characterization and details from Theodora, such as her ideas of climate change and her perceptions on science. And again, these answers are all based on patterns that in the data-driven analyses. We also think it's very important when it comes to co-designing technology with groups, younger groups such as youth and adolescents in general, for them to understand how exactly these data-driven analyses take place and form the personas. So here in this example, the youth can ask Theodora, "Are you a real person?" And then Theodora in the chat responds by explaining how they are not a real person, but actually a character based on patterns derived in the machine learning data to characterize certain aspects of mental health that are common across the population. This is also important because it gives the youth in our workshop an idea of how a chatbot also works through data-driven insights. So there is a co-design element here, but also an educational element as well. Finally, it's also important to be able to engage youth from as many diverse backgrounds as possible to ensure equity. And currently, this is possible with our use of the Survey to Persona platform, which has multiple languages available. So after we conduct these co-designing of scenarios and personas activities, and we get many valuable insights from the youth on how these scenarios and personas can help train the large language model to be more personalized, the research team, so that's us, we work closely with the computer science team, especially the large language model team, to actually embed this into the training of the large language model. After that, youth will get the opportunity to test the large language model in their independent daily lives. So this would be outside of a research setting, and then further consult us on how this large language model can be more effectively personalized to their needs. And we will continue using various design thinking techniques, such as the scenarios and personas that you just saw, to continuously brainstorm with these youth on effective personalization strategies. I want to thank my PhD supervisor, Caroline Figueroa, who is leading the research project that the method I just showed you is part of. This is a project in the Netherlands called AI-based digital health assistance for preventive youth care. Our work would also not be possible without our great collaborators, and this includes Survey to Persona, who created the platform that allowed us to engage youth in chatting with data-driven personas, as well as the Erasmian language model, which we are using currently in our study to train the large language model for personalization. We're also grateful to our many community partners, including Grow Up Youth Work, a youth work organization in the Netherlands, as well as Convergence, a research alliance in the Netherlands. Finally, I would like to thank everyone in my research group. My research group is the Research on Inclusion, Social Justice, and Equity, or RISE, in Digital Health Group. We are based at the Technical University Delft in the Netherlands. It's a beautiful town, and you are always very welcome to come visit us in the beautiful town of Delft. Thank you so much for listening. And if you have any further questions or would just like to chat more about digital mental health tech and participatory co-design or anything that you think might be interesting, please feel free to email me or reach out on LinkedIn. I hope that you enjoy the rest of the conference. Thank you for listening.